there, thanks for joining me today. I'm Heather Granata, physical therapist, and today we're just going to cover a really basic shoulder evaluation. We're going to start with some active range of motion, passive range of motion, and some really basic tests. So just keep in mind as we go through things that in a normal sequence we would start with a test, and as we got information we would move on to the next test. So for today's purposes, really basic, going to rule out some major common issues. We're going to draw a little on the shoulder today. I purposely got a 12-year-old because they are so easy to see everything on. They're really great anatomy partners. So we're going to start with just the scapula. So you can see down here I drew the inferior angle of the scapula. I've got the superior angle of the scapula, and I've got the spine of the scapula runs right across here. So the importance of that is that the supraspinatus muscle, which is the most common muscle torn during a rotator cuff tear, it lies right above that spine of the scapula. The spine runs right into this bony piece, wraps around, and that is the acromion process. The acromion wraps around and connects via ligaments with the clavicle in the front. So what I want to do is stop the camera. Okay, so we're back to the spine of the scapula here, wraps around, and becomes the acromion process. So the joint, the AC joint, right in here, and here's the clavicle. I'm going to do a dotted line on the clavicle. Okay, and that's pretty much the basic bony structure of the shoulder joint. There's a lot more in there with the humerus. We can watch things move a little bit from this angle. There's a coracoid process, a bony piece that sticks out in the front. It's part of the scapula as well. But that's the basics. Do a basic evaluation. So we're going to first look at active range of motion. So the first motion I'm going to have you do is come out to the side, and you're going to do arms up, overhead, and arms down. So let's do that a couple times. Good. And we're watching everything move. We're making sure there's no winging on one side versus the other, instability, delay, and that range is full range of motion. Good. So now we're going to do that to the front. Same thing. So we're going to come up and down, and up and down. And again, we're just watching those shoulders move. Watching that scapula. What is it doing? It's a little different left to right, which is typical for a dominant, non-dominant side. Good. Okay, now we're going to do the Apley scratch test, and what that looks like is you're going to bring one arm this way and one arm this way, and it's just a quick external rotation, internal rotation. Look at things. See that nice bony scapula? And now we're going to do the opposite. Down this way. And again, this is 12 years old, still growing, not a lot of stability there. Okay, so the next test that we're going to do is just passive range of motion. So I'm going to take the shoulder, and I'm looking for pain throughout this movement. Okay, so basically, active range of motion can be bursitis, tendinitis, but when we do passive range of motion and there's pain, now we're really looking at bursitis because we've eliminated the tendon at that point. We are going to do two tests today. One is for supraspinatus tear, that's the empty can test, and the second is an impingement test. So the first one, the empty can test, is arm out about diagonal, thumb down, and we're going to resist. So don't let me move you. Hold, hold, hold. So we're looking for pain. We're looking for weakness. Good. Come on down. Good. So when you, I want to go back really quick. When you rotate downward like that, you're eliminating the deltoid muscle. So that's why we're just testing the supraspinatus. Second test is for impingement, and it's just forceful, resistive flexion. So we're going to, I'm going to get out of the way of the camera. We're going to come up, so come up, and I'm going to resist throughout the full range of motion. Okay. Down. We'll do that one more time and come up. Okay, so that's a really basic shoulder evaluation where we would also rule out any cervical spine issues, any thoracic issues. So thoracic rotation is the last little bit of shoulder flexion. I know for myself, a lot of times I tend to get stuck mid-thoracic or upper thoracic, and I get it moving again, and I've got my full shoulder range of motion. So we definitely want to rule out those two joints above and below the shoulder. So what does this all mean? So focus of care should be strengthening an exercise program set by your physical therapist. If you're positive for an empty can test, I would recommend an MRI, go see an orthopedic, really rule out what's going on. Is it severe? Are you a candidate for surgery? Or do we need to just go really gentle strengthening? So there's lots of avenues depending on what's wrong. It would be completely impossible for me to go through all of them today. Some other things that can go wrong with the shoulder that I didn't really cover are labral tear, thoracic outlet syndrome, and brachial plexus syndrome. So all of those, and there's still another list on top of that. So, but the ones I wanted to include today were really the most common problems. Ruling out neurological problems are always going to be part of the evaluation as well. Again, making sure it's not from brachial plexus, it's not from the cervical spine. So lots of avenues. It's a complicated area. So the joint itself isn't too bad, but the area is full of neurological issues and problems that can impinge those nerves. So that's it for today. Thank you so much for joining me. I hope you learned a little bit about the shoulder and what could possibly be going wrong. And when all else fails, go get a PT evaluation. But otherwise, have a great day. Thanks.